Hi, this is Shauna U. Harriet. I chose for my second career presentation that of licensed clinical social worker. There are lots of different organizations that hire licensed clinical social workers. You could work in a hospital, you could work in a mental health facility, you could work in a school. Can work for the state in their health department or social services department, or just for a private company or private therapy practice as well. Some of the typical stressors are dealing with paperwork. That's always a stressor. And also, just dealing with the problems that come of trying to help people deal with their issues without becoming too emotionally involved with them, and help them meet their needs on an emergency basis as well as a continuing basis, to find the resources they need to help them, be it housing, medical services, transportation, food, those types of things. The typical benefits for a licensed clinical social worker would, of course, be dependent on the employer. And when I was looking for jobs, I couldn't really find anything that listed the benefits. But I would imagine it would be typical of any full-time job that one would have in this social services field. So some of the common job tasks of a licensed clinical social worker, again, depends on the setting, but in a school, a licensed clinical social worker would be a liaison between children, family members, and teachers, and just making sure that the child's needs are met when it comes to educational needs and other needs as well, I guess. Licensed clinical social workers can also work in public health, and there you would provide psychosocial support for a variety of demographics. One of those could be the elderly. That type of thing would include monitoring and coordinating such things as transportation, housing, and providing other information on benefits and services available to your clients. Licensed clinical social workers also assist people with mental disorders or substance abuse or behavioral problems. And so after a diagnosis, the licensed clinical social worker would work with the treatment team to come up with a treatment plan appropriate, and that could include social rehabilitation, counseling, outreach programs, that type of thing. The educational requirements for a licensed clinical social worker is a master's degree, and then also, of course, you have to be licensed in whatever state you wish to work. So I looked up the licensure, I can't say that word, licensure requirements for Utah, and you, of course, have to have your master's degree is required, and then you need 2 years of supervised experience in which you would accrue 4,000 experience hours, and then you would be able to apply for your license, and there's a test that goes along with that as well. Of course, every state has its own requirements. The starting salary range for a licensed clinical social worker is around $51,000 annually, and then experienced can go up to $63,000 annually. Again, that also depends a lot on where you're working, if you're in a private practice or with an organization or with a government organization. So as I mentioned, there are a lot of career opportunities available for a licensed clinical social worker in different settings with different types of clientele that one could work with. I'm most interested in working with youth who have behavioral and or mental health challenges. So this could be done in a school setting, a juvenile justice system, private counseling, organizations that provide foster care or residential care, hospitals, mental health facilities, etc. So I haven't really decided exactly what job specifically I would like as a licensed clinical social worker, but I do know that I want to work in counseling youth. So thanks for your time.